Hi there, my name's Azmain Chowdhury. I go by Dr. Azmain on social media, and I'm so proud to be part of this conference. It's an honour to be able to make a video about this. I just want to talk about some of my experiences starting off as a doctor, and then my quite frankly incredible journey into social media, and just kind of share some of the experiences and learnings along the way. So what kind of brought me towards medicine in the first place is that I have several allergies, anaphylaxis and asthma since I was a child. So being in a hospital setting and seeing how hard doctors work and everything that they do obviously inspired me to go into medicine. I have always had a passion for science, so I mean, that led me into medical school eventually. I went to UCL Medical School, and it was a great time, and I had a lot of fun, and I learned a lot, but it was a struggle. And for most of us, medical school is a struggle, but I think I didn't appreciate how much of a struggle it was for me until after the fact. And then I graduated in 2020, so we were the COVID batch. So obviously there were difficulties with that, but given my asthma, you'd understand that I kind of stayed away from the front lines for a bit. So after I did join, as an F1, unfortunately, about 2 months in, my health had completely crashed. That's due to a number of reasons and chronic health conditions, which I won't go too in-depth into, but it's difficult because when that happens, you kind of think to yourself, well, what next? Am I going to be able to continue my work as a fully working clinician? Like, it just makes you rethink your life entirely. But then I realised something. I had always wanted to start a YouTube channel ever since I was, 12, 13? I mean, 13 is when I did launch a YouTube channel to make Minecraft videos, and, even back then we thought the market was too saturated back in 2010, and here we are now in 2023 with, millions of Minecraft videos on YouTube. And I've done YouTube videos for my band and my music projects throughout school and university. But when that time came that I had to go off work for several months, I just thought to myself, well, I've always wanted to do YouTube, and I've got 6 years of medical school behind me. So the most obvious thing to do is use my medical knowledge and my passion for creating videos, bring them together, and start my social media journey in educating others to kind of empower their ability to take care of their own health, or their knowledge for medical students and whoever, really. So it was about a week after I came off work that I started my Instagram account. And I'd labelled it as Groovy Medic first of all, before naming it after myself, given that stay groovy is like my catchphrase. So that was fine, it was going well. I'd been working on the Instagram solidly for 2 years and 1 month. I started it on the 23rd of October 2020. By the 23rd of November 2022, I still had 600 followers. And within about 6 weeks, I gained 200,000 followers, which is pretty insane. And I'm going to go a bit more into how I managed to do that. So in the meantime, just when I returned to work in June 2021 is when I started my YouTube channel. And it was a slow process. It took me about 3 months to get to 100 subscribers. Many more months to get to 1,000 subscribers, and I'm still not huge in terms of subscriber count on YouTube. My TikTok, on the other hand, kind of exploded overnight when I made video about the heat wave and offering the NHS official advice on it. So I went from about 300 to 15,000 on TikTok overnight. That went to about 28k after a video I did on the polio vaccine, and it's still since consistently been rising to about 66k now, I think. So there's a reason for the Instagram and TikTok growth. That's because I'd managed to come up with a format of medical quizzes, and everyone loves a good quiz. So I'd managed to construct, meticulously design and construct this format that I knew would go viral, using all the tips and tricks that I'd learned from years of watching YouTube and learning about how the algorithm works, learning about audience psychology and what would really attract them. And it worked. It actually worked. And the videos went viral on both TikTok and Instagram. So it's really exciting stuff. And I never imagined all of this would happen so quickly. And now I come onto YouTube because I think that has been truly the most life-changing thing for me. Because YouTube is basically my primary platform. It's where I put all of my long-form videos. I have been focusing on short videos though, because I can cross-post them on YouTube, Instagram, and TikTok. So I was very kindly invited into the YouTube Shorts creator community back in August of 2022. And it's basically like masterclasses and YouTube updates for people who create YouTube Shorts. And I just basically got stuck in, tried to add value to my peers, really engage in the conversation so they all got to know me. I created a Discord community for all of us to hang out and share our experiences and learnings. And they very kindly invited me to the Shorts Community Summit in late October 2022, where I was able to talk about my channel on stage. And at this point, I had just about reached 2,500 subscribers, whereas some of my peers there had tens or even hundreds of thousands of subscribers, and they'd been doing YouTube for many, many more years than me. So for me to be up on stage there talking about my channel, it was such a massive honour. And that's not even where it stops, because I was then invited to the inaugural YouTube Health Conference. So what I basically did is kind of got in touch with the head of YouTube Health and said, I want to form this community of people, of medical creators, to really help each other make the best content we possibly can. And I've actually gone and done it. So the YouTube Health Conference was on the 18th of January, and it was the most brilliant place. I met so many incredible creators. Some of my YouTube inspirations, including people like Ali Abdal, Dr. Rohin Francis, aka Midlife Crisis, Nasir Karma, aka Karma Medic, so many other incredible people across the realms of social media and television. And what really struck me was the energy and enthusiasm in that room, not a shred of ego. It's just everyone is so entirely focused on the mission of democratizing high quality health information for the global public, and that is the entire aim of YouTube Health. So I'm incredibly proud to be a part of that. And running parallel alongside this, I have just launched my new organization called Social Media Medics, and the entire aim of that is helping healthcare creators get a foothold in social media, allowing them to network between each other and really be able to level up their content. So I've got a couple of colleagues who are helping me with this, and they've just been incredible. We make such a fantastic team, and we've built this community of about 75 or 80 of the biggest medical creators across social media and television, and everyone's so keen to get stuck in and involved and really work towards the common goal. And in terms of my organisation, you can find us on Instagram at The Social Media Medics, and we hope to provide really valuable tips on content creation as a healthcare professional, as well as more kind of fun and entertaining stuff to really engage the community, help medical students and creators, because, you know, as healthcare professionals, we put in a lot of hard work to get where we are, and we have a lot of value to provide. It's difficult because we all face things like endless exams, being responsible for people's lives, dealing with trauma, financial struggles, family worries, and burnout. So with all of that in mind, we only have one life to live, and we have so much value to provide, and there is power in community, in bringing our heads together and seeing what we have to offer the world. So that is the aim of Social Media Medics, to bring everyone together and really make a difference, not just for ourselves, but for a global audience. And I think that there is nothing more powerful than that. And I really cannot wait to see what 2023 holds. Because, well, on top of launching this organisation and my own YouTube channel, I'm also planning on launching a podcast, newsletter, website, personal channel, all that jazz. We'll see how it goes. I mean, the world is open, like anything is possible, and I really believe that we can do anything we set our mind to, especially as healthcare professionals who have that deep streak of altruism in us and really want to make something of ourselves and help people as well. In terms of my future career plans, I am considering general practice at this stage because I think it fits with my branding, and also I love that aspect of being, managing to follow up patients and forming that rapport with them, and also having that breadth of knowledge and being able to grasp all of these different disciplines and have a holistic approach to the patient. So I think that's so key, having a holistic approach in anything we do in medicine, and also in social media, I guess. Bringing it all together, considering how we can have a positive influence on the world at large. And I'm going to leave it there. It's been an absolute pleasure, and I hope I haven't rambled on too long. So I really hope that some of what I said has maybe inspired you into believing that despite any difficulties that you may be facing, you're not alone, and you are far more capable than you think you are. And the most amazing things can happen in the shortest period of time if you've consistently put the work in. I've been Dr. Azmain, and you've been wonderful. So, until next time, stay groovy.
Today, I'm going to talk to you about doing an out-of-programme experience during GP training. What is an out-of-programme experience? Why should you do one? And how do you go about doing one?